Hello everyone. This is a channel called Mental Health for Life channel, produced by a team including mental health professionals. In this channel, we introduce you to various helpful and comprehensible knowledge related to mental health to make your life better. This time, we are talking about internet gaming disorder. Internet games, also known as esports, are now in their prime. In the meantime, the number of people is increasing who cannot stop playing games, and gaming becomes a detriment to their lives. Such a game-addicted condition is called a gaming disorder. In 2019, WHO officially identified a gaming disorder as one of the forms of addiction. A gaming disorder is said to be developed in a person who spends long hours on games, say 30 hours a week or 4 to 5 hours a day. The disorder is yet to be diagnosed unless a person is no longer able to control gaming and their life becomes game-centered, which affects the gamer's school life or work life. The disorder can be transient, so when the period of game addiction has continued for over 1 year, the gamer finally will be diagnosed to have a disorder. In some cases of gaming disorder, the patients may have irregular life habits and be too obsessed with games, so they skip meals and get malnutrition. Some people even suffer from economy syndrome due to long hours sitting on a chair. In 2002 in South Korea, a 24-year-old young man suddenly passed away right after playing game for 80 hours straight. If parents take away games and force their child to stop, the child may be verbally or physically violent. The worried parents try to have their child see a psychiatrist. But it is hardly the case. The child seeks medical attention of his or her own will, as he or she does not admit to being addicted. Why do people have gaming disorders? There are various backgrounds in how disorders are formed. Some people genuinely started to play games for recreation, and others, who are socially withdrawn, play games to shelter their feelings in gaming. It is said that if you play games for more than 30 hours long a week, you are prone to be a game addicted. However, every people is not the case. Gaming disorder seems to be formed in specific types of people related to personality and biology. It is said that gaming disorder is particularly common in people with ADHD. People with ADHD are said to have inadequate neurotransmission dopamine, a brain substance that delivers pleasure and achievement. The pleasure obtained by playing games is assumed to supply this dopamine. The fundamental treatment for this disorder is setting boundaries in gaming to the extent the gamer can accept. And once achieved, the phrasal should be given. As such, reduce the time spent on games little by little. Unlike the case of drug abuse, the goal is not to make the patient quit completely, but to reduce the time even a little so that the game shall be less predominant in their life. It is not good to force them to stop playing games. There are some cases where family members who took the games away were violated and police action was taken. Even worse, there was even a student who tried suicide. If addiction is already formed in gamers, some kickbacks will be induced when they are forced to stop games all of a sudden. Some families seeking treatment for their children's gaming disorder are unable to state what is the game of the name they're playing. First of all, it is important to talk with your children about the games. What kind of a game is it? What part is attractive? Why is it so fun? The conversation could begin with such questions. If you still cannot get answers by asking, you can join to play games together. Make it short for gaming hours and make your family conversation a deeper one. If those methods are still impossible, then you can count on a third-party intervention, such as counseling. Hospitalization may be necessary if the patient is not attending school due to his or her regular life habits, suffering from malnutrition, or abusing family members. However, the treatment is only effective when the patient has a will to change himself or herself through the treatment. The treatment of gaming disorder would not work well without the patient's will. If you are a parent who wishes your child to overcome the disorder, try to be attentive to your child's thoughts and feelings. This is the Mental Health for Life channel, If you liked the video, please give it a thumbs up and subscribe to our channel.